With respect to communicating with doctors from a pharma perspective, first of all, realize that the EHR is really the only day-to-day communication vehicle that is available that's digital. Personal access from reps has been largely eliminated, and so you have to speak to the healthcare provider where they are. And where they are digitally, 6 to 7 hours a day is in their EHR, not only for the healthcare provider, but for the healthcare team. More and more now, healthcare service delivery is becoming a team sport with the physician as part of the team, often the leader of the team, but the nurses, the rehab people, even folks that are called patient navigators, people that help patients just get around inside a health system to treat the variety of diseases. So all these people have different communication touch points with the EHR, and it remains the best digital marketing way to reach healthcare providers of any type. One of the things that is interesting to think about is what's called the patient journey from pharma's point of view, and understanding how the patient moves through the therapy with that particular medication for the treatment or maintenance of a disease. From an individual's point of view, they're not viewing themselves as patients, they're viewing themselves as people, and they're not having a patient journey, they're having a life. And so in their life, part of what they're dealing with is their disease. So for them, it's about, I'm a person who is sick, not that I'm a patient who's taking a particular type of drug. And so when we personalize messages from a pharma sponsor's point of view, it's helpful to think of that person as a person, and then put the message that you want to direct to them about your medication in more of what I've been calling their life flow, of which their patient journey is just a part. So personalized to the person, not the category of patient, and I think that's really helpful. Thinking about personalization with respect to healthcare providers, they also are people, and they're doing their job, and part of their job is including medication therapy in their treatment plans for their patients. And any individual medication is only part of the overall treatment plan. The provider, the healthcare provider, has a different point of view about the holistic treatment of that patient. So personalizing the communication from pharma to that provider is really about understanding that that provider is treating a person. Each person is unique. They have probably multiple diseases, and for any of those diseases, even individually, they're taking multiple medications. So take that message and personalize it for the provider in the provider's, kind of put yourself in their mindset, so that you're thinking about, while I, pharma, want to talk to you about one thing, which happens to be my medication that I'm selling, what you want to hear as a provider is, how does this particular therapy fit in to the entire treatment plan for that individual? How does this therapy fit into my life as a healer who's treating lots of different types of patients with lots of different kinds of conditions? How do I stay current, up to date, relevant information, but in the context of me doing lots of different things with lots of different people? And I think that's helpful, makes the message more consumable to the provider, and probably more useful.